Functional movement disorder, or FMD, is a subtype of functional neurological disorder, FND, where movement is the dominant form of the presentation. Functional neurological disorder is a syndrome. There's many different symptoms people can experience. They can get fatigue, cognitive changes, they can have chronic pain, they can have tremor, they can have gait disorder, they can have attacks that look like seizures. All sorts of different symptoms can occur. Pretty much any neurological symptom can have a structural version and also a functional version. So we deal with, in the movement area, are patients who present with difficulties with movement, so mostly around gait disorders, dystonia, where they get fixed posturing. They can have tremor. They can have all sorts of different types of problems with movement. In general, actually, functional neurological symptoms is the second most common reason to see a neurologist. So migraines number 1 and FND is number 2. And that's really important for people to know because many neurologists will encounter these patients in their clinic on a daily basis. In terms of functional movement disorders, the most common presentation actually is mixed movement. So people will have combinations of, let's say, gait disorder and tremor, or dystonic attacks and gait disorder, for example, or weakness in something else. And so that tends to be the most common presentation. Tremor is the second most common, and then dystonia is the third. The way that we think about FMD is the same way that we think about most neurological disease, or should be, and that is that our brain is really complicated and a causal model often doesn't work. So we think about it more in terms of a biopsychosocial model, where patients have vulnerabilities or risk factors that make them more vulnerable to developing the illness. And then often there's a precipitating event. So in the case of what I do in functional movement disorder, it's very often an injury, an accident, or an illness, some kind of damage to the body. And that happens to kind of kick off the syndrome. And then symptoms are maintained by what we call perpetuating factors. So things that people experience in their daily life that actually keep the symptoms going. So things like unchecked or untreated stress, anxiety, ongoing, stress in the home, for example, or medical illness, or other physical symptoms like fatigue, chronic pain, these types of things.